The health of the Pope is recovering well and experiencing no complications, is the report as he tries to get back on his feet.
Joining us now to talk about it is Charles Kimmelman. He's an otolaryngologist at the Manhattan Eye, Ear, and Throat Hospital. Thanks for being with us this morning.
Nice to be here.
Exactly how do you recover from a tracheotomy when you're also dealing with the complication of Parkinson's?
Well, it's a very slow process, and gradually the muscles of the throat return to normal. The breathing apparatus is better. The secretions are less and less, and when things improve and the swelling goes down, then the trachea returns to normal, and the tube can be downsized. And even a tube that will allow speaking can then be inserted.
Doctor, if you had a chance to talk to the Pope's doctors, what questions do you want answered to know more about his condition?
I want to know how good his lung expansion is, what the nature of the secretions are. Are they very thick? Do they have to suction him frequently? How is the swallowing process going?
The other question is, so you're saying that once he has this tracheotomy, he has to keep it now?
For a while, yeah. It would be premature to say exactly when, but I would say several weeks at least. You don't want to take it out too soon and then have to put it back in again.
I understand you have to cover it if you're going to try to speak, correct? I mean, because you need to cover that hole to be able to then talk. But for somebody who's suffering from Parkinson's and the muscles are already weakened, is that something that's going to pose a problem, or will he eventually be able to speak normally?
Presumably he'll be able to speak again, but it will be a long, slow process.
What about we're going to know the answers. We're not going to get everything from the Vatican. That's clear. It's always been clear. But how do you know what's the flu and what's Parkinson's? What questions do you ask to find out?
Well, usually with an acute infection, the secretions have turned a different color. There's a sudden change. Parkinson's is a slowly progressive process. It takes time. And so sudden change like this means that you have something on top of the underlying Parkinson's disease process.
How do you look to you?
He looked okay, better than I thought he'd be at this point.
And if you were advising, would you ask you recommend that they curtail the travel and things like that for him?
Oh, he won't be going anywhere for a long time.
All right, Doctor, thanks.